Hi, everyone, and thank you so much for joining us today. My name is Jeremy, and I am a representative of EHN Canada. We are a nationwide network for treatment centers for addiction, trauma, and mental health. We have facilities located in Nanaimo, British Columbia, Calgary, Alberta, Toronto and Peterborough, Ontario, Montreal, Quebec, and Annapolis County, Nova Scotia. We offer high quality inpatient, outpatient, and online treatment programs. For more information, please visit our website at ehncanada.com. Just in terms of housekeeping for today's webinar, everyone is on mute and cameras are off, but please feel free to use the Q&A box at the bottom of your screen to submit questions for our speaker. We will try to get to as many as possible at the end of today's session. Today's webinar is in fact being recorded, and we will be sending out a follow-up email sometime mid to late next week that will include the link to the video, the slides, and any useful resources, as well as your CEU certificate. Both Selena and myself are currently located in Toronto. Toronto is located on the traditional territory of several nations, including the Mississauga of the Credit, the Anishinaabe, the Chippewa, the Haudenosaunee, and the Wendat's people. It is covered by Treaty 13 with the Mississauga of the Credit. If you are new to this work and want to find out whose land you are on or grew up on, please check out native-land.ca. Many more of you may be physically present elsewhere, and I encourage everyone to use the chat function to, where applicable, share whose land you are on. Now to get to today's session, Indigenous communities, healthcare, and trust with the current system. We have today Celina Sqwasulwut Williams. Selena is a former journalist and student of the Intercultural and International Disciplinary. Selena's academic credentials include recognition from Vancouver Island University, Langara College, and Royal Roads University. Her spiritual teachings are namely Coast Salish and Cowichan tribal territory and Gitxsan nations. Selena was raised within First Nations culture and experienced life on an urban Aboriginal reservation known as Saugi, before leaving to pursue her academic career and travel the world. Selena's life experience has taught her that everyone needs healing, and a significant part of the solution is spiritual. She has herself been in recovery since March 2017. Selena is currently pursuing her PhD with her MA in Intercultural and International Communications. Please help me welcome Selena.
Thank you, Jeremy. I appreciate your introduction and your land acknowledgement. So, first of all, I'd like to say to everybody here, good morning, and thank you all for attending today's webinar on Indigenous communities, healthcare, and trust within the Canadian healthcare system. Your presence today is important at an individual level, a community level, and a societal level. It seems that societal issues are increasingly problematic, localized, and stressful on everybody these days. And unfortunately, some people face more difficult and more frequent hardships than others in certain aspects of society. This is due to things such as historical events, political values, individual morality, misinformation, fear, ignorance, the unknown, discomfort, poor information systems, and biased policy. Having said that, though, I do realize that one sure thing in life is, since the day that we are all born, it's inevitable that we're going to experience suffering. And it's not my intention to take away or minimize the suffering of non-Indigenous people. We all suffer and struggle in different ways during different times in our lives. And we all have different experiences and perceptions of life's events. And today we're all here to specifically discuss the Indigenous experience in healthcare. Now, as you can see on our first slide today, I have the Hulkaminam words for good day. And I'd like to say to everybody, respectfully, Ait Squale, for being here with us right now, and Haichka Siam. This means thank you respectfully for attending today's webinar. I'd also like to thank Edgewood for creating this space and letting us talk about something critical and ongoing and important in our country, the health and wellness of Indigenous populations and the lived experience most Indigenous people have when we're seeking healthcare in Canada. Now, before we get going, on the next slide, I'd like to share a quote from one of my favorite thinkers. His name is Roberto Unger. He's a Brazilian philosopher and politician. Roberto Unger, in Brazil, much like Canada, they've gone through so much colonization, extreme poverty, and the minorities turn to substances often to cope with the conditions that they're born into as a result of capitalist values. And the local population has experienced such extensive oppression with the arrival of the European settlers there, namely the Portuguese. Brazil's Black and Indigenous populations face racism and oppression at an inhumane level, and they face very similar problems that we do in Canada. Roberto Unger, he's on the side of equality and liberation for those who are oppressed. And another one of my favorite thinkers is Paulo Freire. He's also Brazilian. He wrote The Pedagogy of the Oppressed. Roberto Unger and Paulo Freire are both considered to be pragmatic thinkers. Roberto's work has influenced democracy in Brazil following their military regime. Now, he says the following, and I have the quote here: "Deep transformation can begin with small initiatives. Change doesn't require to be a saint or genius. What it requires is the conviction of the incomparable value of life. Nothing should matter more to us than the attempt to grasp our life while we have it and to awaken from this slumber of routine, of compromise, of frustration, so that we may die only once. Hope is not the condition or cause of action. Hope is the cause of action. And for those who fail in hope, should act practically and conceptually so that they may hope." Roberto's work is seen to offer a vision of humanity and a program to empower individuals and change entire institutions. At the core of Roberto's philosophy is a view of humanity as greater than the context which it is placed. And his work emphasizes the need to separate religious-based influence in politics and society. I'd like everybody to try to keep that quote in mind as we get into talking about what we all came here for today. Yes, we are discussing discrimination against Indigenous people in Canada's healthcare system. But the fundamental issue here is that people are needlessly suffering and experiencing emotional pain from the way we treat others as human beings, and that's not okay. Pain, rejection, shaming, exclusion, neglect, oppression, othering, and false social hierarchies cause these social disparities that are influenced by poor political and moral ideas. I think as responsible citizens, we all have a part here. We're all at least a little bit responsible in one way or another. Because we're in a country where we can practice diplomacy and some freedom of speech, we're also able to create change at a systems level, which is a very powerful thing to be able to do. That's a privilege of living in Canada. It's a gift. In a lot of places, citizens aren't allowed to do this. So here we can create knowledge for change. We can practice transcultural, nonlinear reflexivity within our personal lives, our social lives, and our professional lives. We can work together to deliver inherently emancipatory, holistic programming in several institutions and make efforts to keep improving the quality of life for Indigenous people. So I'm going to move on to the next slide now. And basically, in this slide, I have an image here. And what I want to convey in this image is, who am I? Why am I here? What is my experience? Basically, what I'm saying is, why me? So my traditional Coast Salish name is Sqwasulwut. My late grandmother, Celina Sqwasulwut Williams, handed down that name to me in our traditional Coast Salish ceremony several years ago when I was still very young. That name goes back to time immemorial, and the elders have to reach a consensus before the name is handed down to the next generation. For me, I come from a matriarchal family, and I was raised in ceremony by many elders, not only in my family, but in the community. My mother never kept us away from ceremony, and she started teaching us at a young age about the traditional practices handed down from generation to generation. Having said that, as a child, I lived in between two worlds, and I still do as an adult. I think that's something a lot of us can empathize with, that experience of trying to balance two different lives. By that, I mean, I had my Indigenous life at home with my family and my longtime friends who are still on the reservation. And then I have my urban, academic, professional, and social life in the city. And this is something that I struggle with regularly, is transcending that gap. It's jarring. Like many Indigenous people in this country, I was born into intergenerational poverty on an urban Aboriginal reservation. I found that many problems from my parents' generation rolled over into my generation, but in a less extreme way than their time. My mom was the first female in our tribe to go to university, and she was the Indian princess in Canada back in the 1960s. She was an all-star basketball player. She went to UBC and UVic on scholarships because she was that good at basketball. She studied at an all-girls private school before post-secondary because they wanted her to lead their basketball team. My mom used her athletic skill to escape the small town Indigenous life that she was born into. Those are some accomplishments of my mother's life. But the truth is that my family is no different from any Indigenous family in Canada. We have lived through and continue to live through alcoholism, violence, child abuse, incarceration, early and preventable death, costly and preventable diseases, lack of access to basic resources, constant racism, oppression, exclusion, misunderstandings, you name it. My family has major traumas simply for existing as Indigenous people in Canada. My skin is much lighter than the majority of my family members, but I'm just as Indigenous as they are. And just like my mother, I found something I can excel at, and I used it to leave the reservation to get out into the world on my own. And simply because my mom went to university doesn't mean that she could afford us a much better life than the one she was born into. Especially because she's from a place and a time when they didn't discuss Indigenous trauma, Indigenous grief, Indigenous loss. What she did, and what everybody in that generation seemed to do, was they faced it, they stuffed it down, and they moved on. At some point in my life, 15 years ago, maybe 10 years ago, I decided in that regard, I didn't want to live my life in the same way my elders did. I didn't want to be in silence. I didn't want to live in pain, and I didn't want to live in fear without access to resources. I decidedly used my intelligence to think my way through life in order to survive. I studied, I traveled the world, I lived in Eastern Europe, I went to the Middle East and Africa for a long time. I saw more suffering there than I've ever seen at my home life. I went to Syria in 2015, just before the war broke out. I went to Sudan, where the North and the South were fighting over access to water. And still, I saw these people living in war who still smiled. They still had hope. And I realized at that point in my life that I didn't have hope. So I decided to come home, and I went into a treatment center for substance abuse, grief, loss, and trauma. My sober date is March 17th, 2017. I'll be 5 years clean next week. And I believe that I'm honoring my traditional name. And by doing that, I'm part of the theory of change for Indigenous people in Canada. Now, if I can jump back to when I was trying to get into treatment, it was incredibly difficult, as I had a very tumultuous life in my younger years. And by that, I mean, I was in and out of police custody. I was arrested many times. I engaged in theft. I experienced violence from so many angles in my life. I was court mandated to AA, NA, therapy, counseling. I had doctors who didn't trust what I said. Nurses were tired of seeing me in and out of the hospital. Receptionists at doctors' offices refused to book me because of so many missed appointments. And I had no medication because no one would prescribe anything to me. I had no driver's license because I lost it so many times, and the list goes on. My family, thankfully, ended up bringing in professional help to help me access treatment services because I couldn't advocate for myself. And when I arrived at treatment, I finally saw what I was missing out on my whole life. That my voice had never been heard the day before I stepped into the treatment center. I was marginalized and I didn't even know it. And I realized that I couldn't save myself, and I needed help from others to start learning how to live my life. So after I finished treatment, I held my aftercare plan so close, and I listened to every single thing that I was advised to do at the treatment center. I mean, but from every staff member, right down to the janitor and the cooks, because they knew something I didn't know. They knew how to live life, and that's what I wanted. I also realized that if I, an academic who used my intelligence to survive until I got to treatment, I couldn't figure out the healthcare system from an Indigenous perspective. How could other Indigenous people, especially the ones who have greater problems than I had, and less accesses to resources than I had? I decided that I would go to work. I co-created a consulting company. I started working at a treatment center. I did fundraisers for Indigenous people who needed help to get into recovery. So in these next slides, there are people who I've worked with who got sober and got their lives back. Each one of them expressed the racism and neglect they experienced while trying to access healthcare in Canada. Each one of them has offered to work with me to help Indigenous people follow in their footsteps and get help. I think that we're able to bridge that gap, and we can do it coming from a good place. Now, here's a few of the people that I work with. If you look at the one on the right with the teepee, this guy here, he just got a year sober. He's also the one giving a peace sign in the field. He was on the streets in Duncan, BC on Vancouver Island. He was one of the most known drug users, and now he has an amazing life, clean and sober. The guy with the feather in the bottom left corner, he's coming up on a year. He went to treatment in Alberta from BC. This guy with his son, he's in Vancouver. The one with his girlfriend and his mother, he has 6 months sober right now. And all of these people didn't know that they could have this life. And they still talk to me to this day. And they've all said on multiple occasions that they're happier now than they've ever been before. And they don't think that they could have navigated our healthcare system on their own without my help. So I feel that my job is important, but it would be nice if my job didn't have to exist. Moving on, I saw the flaws in our system, and I wanted people to see what I saw. And the most logical thing that I could think of was to go to community and draw attention, which is why I did those fundraisers, because I thought this is an issue people need to know about. Now, as a sober companion and as a referral agent, I work with mostly young Indigenous men who are active in addiction and want to get sober. What I do with them, from the day I meet them and I get that phone call, I go to every doctor's appointment they have. I go to the pharmacy with them. I make their healthcare phone calls for them. I speak with every person who has a part in filling out their application form for treatment, because the likelihood of these young Indigenous guys experiencing racism or oppression or neglect or assumptions in our healthcare system is unfortunately unnecessarily high. And I don't think we can afford to keep watching Indigenous people die from addiction and poverty in Canada, especially if it's from avoiding the healthcare system itself. My big dream, the blue sky in my work, is simply to see Indigenous people get their lives back, to honor their ancestors, and to end the legacy of colonialism in their own personal lives. Just like there's a fellowship of AA, I would love to see Indigenous Recovery Fellowship. I mean, we make up less than 4% of Canada's national population, but almost half of the prison population. That's not okay. It's sad. It's a colonial legacy. And I believe that we have the power to fix that by working with each other. I'd also like to add that each individual in those photos gave their consent to share their picture. So what I'm going to do now is move on into the articles that we've got for today. About these articles, they're all peer reviewed, and we have a blend of qualitative and quantitative data. Some of these articles have recommendations, and others act as a means of relaying information and leaving the implications up to decision makers. Now, a quick side note here is that the unfortunate thing about a lot of good research is that it will never get read by most people. And for more critical research, certain stakeholders don't want certain information to get out to the public. I think that if the good research was more available, that change would be easier to happen in Canada. So the article that Edgewood shared with us is titled Unmet Health Needs and Discrimination by Healthcare Providers Among Indigenous Populations in Toronto. This article was published in late August 2019, so it's relevant and it's timely. We'll be using this article and subsequent supporting articles as a foundation for our discussion today. So first of all, what are they saying in this article? The first thing I wanted to do was check out who funded it and why. So the Canadian Institute of Health Research, which is the acronym is CIHR, they provided a grant to this research team. The research team said that their primary objective is to examine the key association between those experiencing discrimination by a healthcare provider, plus having an unmet health need in the last 12 months. The secondary objectives of the article include looking at the impact of specific social determinants of health, including access to healthcare and socio-demographic factors. In terms of the methods, not methodology, they used respondent-driven sampling. So they had 836 participants, which is huge. It's a very large project. This particular research is quantitative as they use survey questions, and it's qualitative because in order to complete the data collection, they did one-on-one interviews, which I think is super cool. I also think that using a 12-month time frame was a logical decision by the researchers, rather than talking about several years and keeping it overly general. Because of their findings, which are significant, I'd say this paper is likely an addition to an existing foundation of empirical research on discrimination against Indigenous populations in Canadian healthcare. So there's an ever-growing demand from marginalized communities to have their own researchers work as part of the research rather than simply being subjects for research, because that doesn't benefit the marginalized community. We also see this at an international level from developing countries. It's thematic, and this stems from historical events when non-Indigenous researchers would go into Indigenous communities and take away their findings and leave the locals to remain impoverished. This is called cherry picking or helicopter research. You swoop in, you take your material that you want, that you're going to benefit from, and then you leave. So in order to try to address that and attempt to correct that, research centers are now recommending that researchers, if they're not Indigenous, but intend to work in Indigenous communities, to at least have extensive historical knowledge on the relational history between the Indigenous community and the non-Indigenous populations. And I think that there's ample context for why things are the way they are today in society. So I'm going to say something extremely direct, and I don't mean any harm here, but this is part of a conversation that needs to be had, which is why we're all here today. And the fact is that Canadian governance was built by non-Indigenous people for non-Indigenous people. Our political leaders at the time created systems designed to oppress the Indigenous minority and exclude Indigenous people from the opportunity to thrive and to flourish. Now, because we have long-standing historical issues, now we have contemporary consequences. These consequences are described in the reading material for today's gathering. Now, before we go forward, I'm going to ask everybody here the following question. My question is, how are you supposed to exist in a society that doesn't want you to be you? That's part of what racism is. That's what oppression is, and that's what othering is. I think that there's things you and I can do to keep pushing for change and inclusivity, though. So moving on to our next slide, I would like to bounce back for a moment and discuss our learning objectives for today's gathering. And one of the points is to explore the current healthcare system and identify areas that need to be modernized. Another point is to define the role of healthcare providers and how they play that role in ensuring the safety for a welcoming space. Lastly, we're going to have an introduction to implementing diverse and inclusive programming and treatment for the Indigenous community. I think that all of these objectives are addressed by the researchers in these papers today. In my own words, I would say that we need a transcultural, nonlinear, reflexive approach while working with an Indigenous population who are accessing healthcare services. We need to continue creating knowledge for action. And we can do this in several ways by supporting research and data collection, creating knowledge for action, attending these meetings, changing our own individual behavior, being more involved in the policy aspect of Indigenous healthcare, working directly or indirectly with the Indigenous population, and simply being open-minded. I'm not saying that Western thought is flat out wrong or that Indigenous ways of knowing are the right way. I'm not saying that. It's my perspective that there are so many truths. We all have valid perspectives on lived experiences. We need to have a more inherently emancipatory, holistic programming in Canadian healthcare. You know, we can look at the current healthcare system through an anti-colonial lens to help Indigenous people seeking healthcare by deconstructing social constructs with cultural consultations. I think that now would be a good time to move on to the video. It's 10 minutes in length, and I'm sorry to anybody here who isn't a Gabor Mate fan, but I will say that he does have some very accurate things to say about trauma and life and addiction. I'd also like to note that I'm not focusing on approaches to recovery here, and by that I mean abstinence or harm reduction. What I want everyone to think about is how many Indigenous people are born into the environment described in this video. An array of adverse early life experiences in a society built on colonization and oppression where the current healthcare system has failed so many Indigenous people. So try to keep that in mind as you're watching the video.
So an addiction is a complex psychological, physiological process, but which manifests in any behavior that a person enjoys, finds relief in, and therefore craves in the short term, but suffers negative consequences in the long term and doesn't give up despite the negative consequences. So craving pleasure, relief in the short term, negative consequences in the long term, inability to give it up. Now, notice I have said nothing about substances. I said any behavior. So it could be related to cocaine, crystal meth, heroin, fentanyl, marijuana, nicotine, alcohol, whatever, could also be sex, gambling, internet, relationships, shopping, eating, work, extreme sports, working out, pornography, any number of human activities. So I said any behavior. Now, the official definition of addiction, according to the American Society for Addiction Medicine, is that this is it's a primary brain disorder. It arises in the brain, largely due to genetic reasons. This is how they see it. And I say that's just not true. The other popular idea about addiction is that it's a choice that somebody makes, that people choose to be addicted, which is what the legal system is based on. Because if people are not choosing, what are we punishing them for? And although I think the medical definition is closer to the truth, I don't see it as it's a genetic disorder, and I don't see it as a primary brain disorder. So let me perhaps show you why, if that's okay. A human being has two fundamental needs, apart from the physical needs, in infancy, in childhood. One is for attachment. Now, attachment is the closeness and proximity with another human being for the sake of being looked after, or for the sake of looking after the other. Now, human beings, as mammals, and even birds, are creatures of attachment. We have to connect and attach because otherwise we don't survive. If there's nobody that's motivated to take care of us, to attach to us that way, and we're not motivated to attach to others, we just can't survive. One of the interesting things is that the endorphins, which the body's internal opiate chemicals, which heroin and all the other opiates resemble, they help to facilitate attachment. So if you take infant mice and you knock out their endorphin receptors so they don't have endorphin opiate activity in their brain, they won't cry for help and separate from their mothers, which would mean that they would die in the wild. And which goes back to what happens early in childhood when there's stress and trauma, these endorphin systems don't develop. And then when people do heroin, it feels like a warm, soft hug to them. They feel love and connection for the first time. That's why it's so powerful. But so we have this need for attachment, without which obviously the human infant, who's the most helpless, the most dependent, the least mature of any creature in the universe at birth, cannot survive without the attachment. And that attachment relationship, given that we have the longest period of development of any creature, well into adolescence and beyond, attachment is not a negotiable need. But we have another need, which is authenticity. Now, authenticity, auto the self, means being connected to ourselves. Just knowing what we feel and being able to act on it. So, that means our gut feelings. So, let's look at how human beings evolved. For hundreds of thousands of years, and for 100,000 years or so of this species existing on Earth, how did we live? We didn't live in cities and houses and so on. We lived out there in the wild until very recently in human existence. Now, just how long do you survive in the wild if you're not connected to your gut feelings? Not very long. If you start using your intellect instead of your gut feelings, you just don't survive. So that's a powerful survival need as well. So attachment is a survival need, authenticity is a survival need. But what happens if your authenticity threatens your attachment relationships? For example, as a 2-year-old, you get angry because you didn't get that cookie before dinner. But your parents can't handle anger because they grew up in homes when there was rageaholism and they're terrified at the very expression of anger. So they give you the message that good little kids don't get angry. The message you receive is not that good little kids don't get angry, but that angry little kids don't get loved. Because your parents are now sullen, they won't look at you, they talk to you in a harsh way, you're not getting loved. Not experiencing love at that moment. Now, but you gotta stay attached. Guess what you're gonna suppress? The authenticity every time. And this is how we lose connection to ourselves and to our gut feelings. So that, strangely enough, that very dynamic, which is essential for human survival in a natural setting, not becomes a threat to our survival in this more modern setting, where to stay authentic is to threaten attachment. And so we give up our authenticity, and then we wonder who the hell we are, and whose life is this, and who's experiencing all this, and this life doesn't, and who am I really? And so that's where the reconnection has to happen. That's where the healing happens, is with that reconnection. But it's because of that conflict the tragic conflict in childhood between authenticity and attachment that most of us face, that we lose ourselves and lose connection to our gut feelings. Now, this leads to the question of trauma, because it's one thing to recognize that all this originates in childhood pain. It's quite another to transform that pain. And for that, we have to understand what trauma is. So people often think that trauma is what happens to you. So trauma is a divorce when you were small and your parents fighting. Trauma is your mother's depression. Trauma is your father's alcoholism. Trauma is your parents' argumentation. Trauma is physical or sexual abuse or some loss. Those aren't the traumas. Those are traumatic. But the trauma is not what happens to you. The trauma is what happens inside you. And as a result of these traumatic events, what happens inside you is you get disconnected from your emotions, and you're disconnected from your body, and you have difficulty being in the present moment, and you develop a negative view of your world, and a negative view of yourself, and a defensive view of other people. And these perspectives keep showing up in your life in the present. So in other words, the addiction is not the primary problem. It's an attempt to solve a problem. And then the real question is, how did the problem arise? In other words, this is where my theory is that it's always rooted in childhood trauma, and that the addiction is an attempt to deal with the effects of childhood trauma, which it does temporarily, while it creates even more problems in the long term. And so the issue is not just to recognize what happened 10, 15, 30, however many years ago, but to actually recognize the manifestations in the present moment and to transcend them. And how do you do that? By reconnecting with yourself, by restoring the connection with your body primarily and with your emotions that you lost. And once you do, when you found these things again, then you have what we call recovery. Because what does it mean to recover something? It means to find it again. So what is it that people find when they recover? They find themselves. And the loss of self is the essence of trauma. So the real purpose of addiction treatment, mental health treatment, any kind of healing is reconnection.
There's a quote that Gabor Mate included in the end of his video about how we're not responsible for the world that's created outside our minds, but we can be responsible for the world that we create in our minds. That's our perception of reality. We had a question earlier about what is social constructionism. So I'm just going to quickly touch on that before we move on. And I know that we don't have a lot of time, so I'm going to give you the very quick version of that. Social constructionism is how we see the world as created and developed by those that we surround ourselves in. And that can be family, it can be friends, it can be school, it can be work, it can be the society we live in. And that shapes our sense of identity and the lens that we see the world through. That is social constructionism. Now, the message that a lot of Indigenous people get in Canada, is that we have problems. We are a burden to society. These are longstanding historical problems. And unfortunately, a lot of messages just say to just accept it and move on. I've included an article, it's very short, on the definition of social constructionism. And as I understand, that's going to be sent out in the next few days, along with all of the other reading material and the slides from today's gathering. So back to the video. he covers so much stuff in that video. Now imagine being the person that's born into that environment. You are par for the course as an individual who is more than likely going to need to access healthcare services as you grow older, only to get rejected by the healthcare practitioners and failed by the system. Getting out of that lifestyle is unnecessarily hard, but it's not impossible. And take a look at my life. I got out because people like yourselves cared enough to support me, to teach me, to work with me. And I had a part too. I had to meet halfway with the people who work in the healthcare system. And for me, that meant that I had to learn to trust people, that they weren't going to let me down, and that I wasn't going to face another event of rejection simply for being me. It takes efforts on all fronts to recover this situation. And I believe we can make change. If I didn't think we could be making change, then I wouldn't be doing my PhD and I wouldn't be here today. A quick note about my PhD is that my PhD is on long-term abstinence-based recovery in the Indigenous community. My co-researchers are going to be elders who have acquired a lifestyle of long-term abstinence-based recovery, because I found a theme that it was blended at a blended approach to recovery that worked for them. And by that, I mean traditional Indigenous ways of knowing and the Western medical model of recovery. I think that the Indigenous elders who have learned to live in abstinence recovery long-term hold the solution. And right now, they're being overlooked. They're the key. I think they're central. So what I'd like to do now is build off of that video we just watched. And there's another article titled Abstinence-Based Recovery versus Harm Reduction, and it's considering follow-up and aftercare in First Nations addiction treatment. And I chose this not because I want you to choose a side between harm reduction and abstinence, but because their recommendations are so clear and concise. The researchers in this article strongly suggest a blended model for recovery is what works best for Indigenous people seeking healthcare. And as I just said, that means combining traditional Indigenous cultural practices and the Western medical model of recovery. And for anybody here who's been to treatment, you know, and I know, that only you change. The rest of the world outside stays the same. And we have to learn how to live in that world without abusing substances in order to survive day to day. So in these articles, the researchers make strong recommendations for aftercare for Indigenous people who sought inpatient healthcare. Indigenous people who go straight home after 8 to 12 weeks in treatment tend to relapse and get stuck in that cycle again and again and again. Why? Because life on the reservation and poverty is brutal. In BC, we have the First Nations Health Authority, and this provides treatment and healthcare for Indigenous people. However, these FNHA treatment centers do not have rolling intake. They do not have detox beds. They do not have second stage recovery homes. There's no option for second stage. These are system problems. We're talking high level issues. We have to influence at that level. And that's why I'm doing my PhD. That's why I'm here today. And again, I'm going to be very honest here. Indigenous treatment centers are the lowest common denominator. What kind of message are we sending people who go to those Indigenous treatment centers when they're provided the bare minimum care? What we're doing is reinforcing the message that they don't matter and they don't deserve good things. That's something that needs to change on the policy side of things. We need better quality care for Indigenous people and not the lowest common denominator. Indigenous treatment centers need detox beds and second stage options. The idea here is to reintegrate back into a diverse society, not become further removed and more isolated. The interesting thing that I found in my work and my research is that a lot of Indigenous people think intergenerational trauma isn't a real thing while they're actually living it. I was one of those people, and it was only going to treatment that helped me open my eyes and see reality for the first time. I think that's when it's important for therapists and mentors to be available to Indigenous people once they've got their training wheels in recovery. And unfortunately, those professionals being available hasn't really been the case to date. I also think that there's a fear in the Indigenous community of asking for help because so many people are afraid of rejection, and rightfully so, given the history of Indigenous and non-Indigenous relations in our country. So we need to implement a system that's able to respond accordingly when, sorry, my computer's freezing. We need to implement a system that's able to respond accordingly when an Indigenous person finally does ask for help. Unfortunately, when people are in addiction, there may only be one chance when we get to agree to help before it's too late. Lastly, I've included an article in everybody's reading package, and it's called Two-Eyed Seeing. This is a framework for understanding Indigenous and non-Indigenous approaches to healthcare for Indigenous people in Canada. Each one of these articles speaks to the 3 learning objectives for today's discussion, and my hope is that you'll find this information useful and you'll really have a good look at these articles that articulate the problems very well. I also think that we have more than enough indicators of our societal problems, and we need a holistic, transdisciplinary, pragmatic action research program and actors to recover this situation. And I think that simply by being here today, you're part of Knowledge for Action. Not one entity or organization can make this tremendous change on its own. I believe that these articles speak to exactly that, the effort that we all have to put in to see positive change. Now, my first question when I read the article is, what is two-eyed seeing? Well, it's a theoretical framework that embraces contributions on both Indigenous ways of knowing and Western ways of knowing. The authors say that we have to give equal consideration to diverse Indigenous and non-Indigenous worldviews, such that one view does not dominate or undermine the contributions of others. By using this two-eyed seeing approach, we can reshape the nature of the questions we ask in the realm of Indigenous health research. Health research, as we know it today, has almost been exclusively understood from the perspective of Western European science. The dominance of the European perspective can be seen in our education system in Canada. It's been noted that in Canada, we're teaching a very colonial version of history that intentionally erases the key roles played by Indigenous people in the settlement of what we now know as Canada. And as a consequence, our education system has been established as one specific truth about its past that fundamentally ignores Indigenous perspectives. You know, it's been claimed that this absence of Indigenous history in curriculum across the country contributes to the ignorance and lack of respect for Indigenous experiences, Indigenous knowledges, and Indigenous perspectives. If we can all learn to appreciate all perspectives, then the authors say we can learn to see the world with both eyes, hence the title of the article. Essentially, what the author is saying is that the sum is the parts of a whole are more than the sum of the parts individually. I think as Canadian citizens, we are all important stakeholders in our healthcare system. And individually, there isn't much change that we can create on our own. A positive change will be transdisciplinary, cohesive, rational, logical, inclusive, holistic, emancipatory, informed, respectful. As they say in AA, back to basics, love, kindness, tolerance. Those 3 things will take us a long way, but we also need to practice pragmatism. And if you recall the quote from the beginning of our webinar, we can't give up hope in fixing an overburdened system. with its roots still deeply tied into colonization and exclusivity. The change has to come from within, not from the outside. And I think we're doing it. It took a long time for us here to get here as a society. So unfortunately, it's going to take a long time for us to get out. But I don't think this is hopeless. I think we're all doing the right thing just by being here today. Moving on, government and professional responses to social pathologies, providing more healthcare or supporting traditional forms of healing, they are essential, but they don't address the most fundamental cause of suffering. There's many forms of traditional healing that are currently undergoing a renaissance and spreading across diverse cultures and communities that must be considered from this larger perspective. The resurgence of interest in traditional practices is part of a more global movement to regenerate Indigenous identity and to explore the significance of evolving cultural practices in modernity. When I say that, I'm thinking about, take yoga, for example. People are bringing back that old practice in a new way to continue healing and improving their quality of life. We can also do that with sweat lodge. People do Tai Chi, meditation, things like that. So I'm going to wrap up here. But before I do, I would like to say that I believe that we as a society, we can have a socially reconstructed, sustainable innovation here without formalized reconciliation. My opinions on reconciliation are something for another conversation. But by using a transcultural, nonlinear, reflexive approach in creating knowledge for action, we can help reduce disparities in Canadian healthcare. At all levels, we can practice inherently emancipatory holistic programming. We can refer to anticolonial lens. We can review the current conditions of our healthcare system and consider how deconstructing social constructs with cultural considerations can positively impact both Indigenous people and the non-Indigenous populations. So as we have in our last slide, Haichka CM, which again means thank you all respectively.
Perfect. Thank you so much, Selena. Just to echo everybody in the chat as well, people have been saying thank you so much for the insight and for your transparency and your authenticity when speaking. So just to reiterate, thank you so much again, Selena, for all of that. We do have time for about 2 questions, so I will. What helped you to take the first step towards healing as a generational trauma can take a toll on you?
I really appreciate that question. Thank you. You know, I could talk about that for a long time, but to try and really cut it down, I saw the way that my aunties and uncles grew up. I listened to the way they described their lives, and I was aware that my mom was one of a few people from our tribe who actually went to post-secondary, and I wasn't aware of my privilege in that way. I grew up on the reservation, and it was just normal to me to see the way that we lived our lives there in such poverty. And I started to lose myself. I knew that I had the ability to do well, but I could not get, I couldn't get on the right track. And I started to realize that it wasn't society that was the problem. It was my perception. It was my ontology. I think it was Olivia who asked, what is social constructionism? It was the social construct of the way that I saw the world that was the problem, and I didn't know how to fix it. So I saw people in recovery, and I knew I wanted what they wanted, that they had lived the life that I was living, and somehow they got out of it and they were happy. And I figured, I was told, they say, if I can do it, you can do it. And I did it. That's what encouraged me to take my first step. Also, I saw elders who I really respected, and I was scared of them knowing who I was, what my behavior patterns were. And they said, I was exactly where you were before, and you can be where I am, but you got to sober up. And I never thought I was going to have that spiritual awakening and treatment, but I did.
Amazing. And like you said, you're coming up on 5 years, which congratulations again. It's probably so eye-opening and jaw-dropping to even think 5 years ago, a year ago, whatever it may be, to see the point in your life, in your journey that you're at now, that it, like, you've become that person, right? Like now you're that person that people look up to and see, like, I want to be like Selena, like I want to push myself to that facet. So I'm sure it's just like a full circle moment for you.
It is and it isn't, because I feel like I'm still on this journey. I'm in the beginning. And very early in my recovery, I was asked by a therapist. I went and found a therapist. I did all of the work. It's not easy to find a therapist. And she said, why do you want to be sober? What do you want? What do you want to be? What do you want to make of yourself in this life? And I said, I want to become an elder. I feel that there's a difference between an elder and an old person. Like, elders do the work. Old people age. And I have so much respect for elders, and not just Indigenous elders, but, like I said, all of us are going to experience suffering from the day we're born. That is one truth about life. And to be aware of all of these people who have overcome so much traumas in their lives, and to see that they have balance, they have integrity, and they have happiness. That's what I want for myself.
I love that distinction between elders and old people. Like people are saying in the chat, like it's a great distinction and it's very insightful. So thank you for sharing that. We do have time for one more question. It is quite a large question. So it's like, I'm sure we could do like a whole another hour about this. But so the person says, I believe in the importance of connection, and I loved what you said about building trust. What would you say is the best way to build trust with those who have been failed by these systems time and time again?
I went and met them where they were at. I looked at them and myself from a perspective of humanness, not a professional working with somebody who needed help. I saw human suffering, and I approached them at a human level. And I've learned that working with marginalized people, that going into offices and picking up the phone and making these phone calls to professionals can often be uncomfortable. So I've gone and met people underneath bridges. I've gone onto, the most impoverished reservations. I meet them, that turn of phrase we use, meet people where they're at. That's what I do. And I think I said in my presentation that going back to basics, that simple phrase from AA has really helped me get to where I'm at today. I think that for non-Indigenous people who are working with Indigenous people, the best thing you can do is try to reach them at a human level. I sense the fear when I'm working with Indigenous people when they step out of the reservation and into the larger society. The walls go up, and that's because of historical traumas. And I do my best to to try and show them that, hey, we're not all bad. Like, there are great people out there. Recovery, the concept of recovery is holistic. And my goal working with Indigenous young men is that they will see the holistic, empathetic, humanness aspect of recovery. And I've also learned that those who really get it, they're the ones that have stayed sober. Those who go back to the trauma are the ones that go in and out of the system.
Absolutely. Thank you so much. Unfortunately, this is our time. We could go on for hours, I'm sure. But Selena, I just want to thank you so much again for such an informative and insightful presentation. Your personal tie-ins with this is second to none. And as always, a pleasure to have you on our webinar series. And we look forward to following you along your journey. So thank you so much again, Selena.
Thank you, Jeremy. And thanks for everyone for attending today. Like I said earlier, I have a reading list and we'll make sure to get that out to everybody in the next few days. And my hope is that you'll look at it and you will really absorb the material that's going to be available to you in the next coming days.
Yes, yeah. So to just follow up on that, we will be sending out a follow-up email that will include a copy of today's presentation slides, a copy of today's recording, and then as Selena mentioned, she has compiled a reading list for everybody to take a gander at as a resource list. So we hope to see you at future webinars, and thank you so much for joining today. Take care.